Let's look at cystoid macular edema. Cystoid macular edema is a painless disorder that affects the retina. The retina is a light-sensitive layer of tissue that lines the back wall of the eye and responsible for vision. When this condition occurs, swelling develops in the macula, which is the central portion of the retina critical for seeing fine details clearly. These swollen areas fill with fluid, causing the macula to be thickened. So some of the causes that can bring about macular edema are things like eye damage. Maybe you had a trauma through fighting or accident. Diabetes can also bring about edema because small blood vessels at the back, if for a prolonged period of time someone who is diabetic is not controlling their blood sugar levels, small tiny blood vessels at the back can leak and cause this edema. Sometimes due to aging, we have the condition called age-related macular degeneration. So we have a wet type of age-related macular degeneration. That one can also bring about macular edema. Sometimes blockage in blood vessels and eye inflammation. So these are some of the things that would bring or cause macular edema, among other causes. So some of the symptoms that someone will report having macular edema are things like blurry or decreased vision. So maybe when they're looking at a distance, things will not be that clear, and sometimes distortion. When they're looking at an object or they're reading a text in a book, things will appear distorted. So to my right is an OCT image that is showing abnormal retina, which shows that it's been filled with some fluid. So when you do an OCT, this will help in confirming that there is macular edema. So fluorescein angiography is one of the tests that can also be done. So in fluorescein angiography, what basically it does is the use of a drug called fluorescein that is injected in a vein in an arm, and it is used to enhance specialized photography that is taken to evaluate the retina. So, and treatment for macular edema, most of the time they'll prescribe anti-inflammatory eye drops, oral diuretic medication, oral steroids, or non-steroidal medication to reduce the swelling. That's it for today. Macular edema.